YouTube, what up? You know it's your boy Marlon. I'm back again with another brand new video for you guys. How's everybody feeling today, man? If it's your first time to my channel, please go ahead and subscribe for more great videos. I'd also like you to like and share these videos with your friends and families. I also want you to leave a comment below in the comment box. Let me know what you think about today's topic. Give me your views and thoughts, because your feedback means a lot to me, alright? So today, guys, we're going to be talking about the coronavirus, aka COVID-19. So we know that the coronavirus have been rampanting across the world. Here in the US, it's starting to grow like crazy. Each day here that there's more cases that have been found, and whatever the count is that they give you, there's always more. The count is just based on people who have been tested and came out positive that they have the virus. So we know that the COVID-19 have killed a lot of people worldwide, and the numbers have grown more. And over time, for countries like the US and other countries out there who have been just starting to be affected by the disease, it is going to grow more, and they're more likely that there'll be more fatalities across the nations, across the world. And the number will keep growing in people who are infected by the disease, or even people who have passed off from it as well. If it keeps going the way that it is going, I think by the end of this, there will be hundreds of thousands of people who will be killed from this virus. I hope that they will get it under control by finding a vaccine to stop the virus, that they can give it to people that will prevent them from getting the virus, and also for people who already is infected by it, that it will stop it from getting worse, and that these people can recover from it. Also, I hope that all these medical facilities out there will get enough equipment and staff on board, healthy staff, and I hope the staff will also keep themselves to prevent them from getting infected, that they could be able to help other people to overcome this really hard time that all nations across the world is going through. And we all need to come together and fight this virus so that our survival is great. Alright, so guys, you know the COVID-19, it's one of the big things now that everybody's talking about. But you know what is even worse and driving more fear in people's life today across the world, and also here in America, very big. Because you know a lot of people have mortgages. A lot of people have car payments that they have to make. A lot of business places is going out of business today, because especially people who work in the food and beverage space, a lot of those places have been closed across America. Probably about 80 to 90% or even more. Bars and restaurants already been closed down, shut down. Some of these business places, they might make it back to come back in business. Depends on how long this crisis take to be over. A lot of these businesses are going to go into bankrupt, where they might not even able to bail themselves out, because a lot of these business owners, they don't own their business outright. They're still paying the bank mortgage for these businesses that they have running, and you know the bank has to get their money. So I don't know if banks will give them a break on making payments until this situation is under control, or if not. I know for my mortgage it has to be paid. I don't think the bank is going to give me any break in payment, so my mortgage has to be come up with monthly in order to pay, so I can have a roof over my head. And so are a lot of other Americans out there and other people living in other countries all over the world. A lot of the people who work in the food and beverage areas, now they have to be trying to find a new job or even go on unemployment. What about countries out there who does not do unemployment like how they do it here in America? I know that there's other countries out there who do unemployment if you go out of job, but there's countries out there who do not provide any unemployment benefit. If you go out of job, you're on your own. You have to find some means and some ways out there to be able to make money to feed your family and yourself, and to take care of all the bills, the power bill, the water bill, the phone bill. Even if the phone bill is not too much of a necessity the water bill, the light, you gotta keep that on the roof over your head, and food on the table, and that's pretty hard if there's no money coming in and money's going out. So a lot of people are panicking that this is gonna put the world in such a deep depression. Financially, people are gonna be in a deep hole, and the world will struggle to recover from this disaster that we're having right now with this virus. So yeah, that's one of the main thing right now than even the virus that is driving fear in people across the nation minds. There's a lot of people already got laid off. People, they did close a lot of stores on the mall, and some did still open, but now all the malls are closed down, shut down. Any public here that is too busy with people, bars are shut down, the malls are shut down, all the restaurants, the fast food joints are closed down. There's still some open that you only can get food at the drive-thru, but that only will be a matter of time before that is closed down. All the daycare centers across the US have been closed down, so parents have to be switching back and forth in one go to work so the other can stay home and watch the kids, or they will drop them off with the grandparents or a close family member or even friends to babysit for them if they can while they go to work. So it's even tough for those people who are still going to work, that their job is still providing employment for them, but they cannot find anybody to watch the kids so they can go to work. Schools also been shut down across the US. There's in some states from the end of January, early February, they already declared that school is closed down for the rest of the year. So some of these kids are only getting 2 months or close to 2 months of schooling for the year. Some of them will be doing online classes. I don't know what the others are going to do, especially for the kindergarten kids. But schools are shut down. They're still pushed school back further. Some states still giving it until the beginning of May, with some states already shut down period for the year. So they're still thinking that school might not be open for the rest of the year. So the more this virus spread, they'll either push school back a few months from now, or it will be shut down for the rest of the year. So those parents now has to be trying to figure out what they're going to do to watch the kids while they go to work. One of the other thing, man, out there is a lot of people are panicking. There's no money coming in. People who work in minimum wage jobs who didn't have a lot of savings that they can fall back on. This is gonna be a hard, rough time on them. For single parents out there who is only one income coming in the household, and to get laid off your job, don't know when these businesses are gonna be open back their doors. And a lot of other business places that are still open. To all those business out there who is still open, you have to give thanks to those business owners who still able to keep their door open so that their employees can still able to make some money. And also some of these businesses that are still open, they have been open full hours that they normally open for the day. They've been closing business early so they can restock their shelves, and also so they can do cleaning, deep cleaning each day to try to clean back their display and so forth each day, so that when the new people come in the next following morning for shopping, there is a clean environment, so it will minimize the risk of spreading. It will not stop it from spread, because you cannot clean everything out there that somebody touched in your store, but they're minimizing the risk. But it's up to you as a shopper, you out there in the public, to prevent yourself. You're the one who's gonna more likely to prevent yourself from getting this virus by keep your hands clean, wash your hands properly. If you're gonna put your hand in your face at all, just make sure there's not a saying that you can't touch your face. If you know your hands are clean, they're washed properly, you can touch your face. But if you go touch something and haven't washed your hands since you touched something, it's best to make sure that you wash your hands first. If you're gonna cough in your arm like this, Do not cough in the middle of your hand because you might go touch something and spread the virus if you have it. And you can have it and not even knowing that you have it and be spreading it around. That's the danger about this virus. And it can live on surfaces, depends on if it's metal or cardboard or wherever it's on, that it can live in some of these areas longer than others. So somebody could pass there yesterday and touch the area, and you go touch it and bring the disease to yourself. So guys, be careful out there, and I hope we will get past this as soon as possible. It's putting a damper on everybody, even those people who are, even if you're self-employed. A lot of people don't want you to come to their house right now to do any work. Even if you're working in construction, you do home repair, a lot of people don't want anybody in their house right now. For even people who sell house, real estate agency, they are getting a hit as well, because a lot of people who live in their home still and still showing it to sell it, to move on to another home or to move out of state or something, or downsize, whatever the case may be. They are taking their house off the market right now because they don't want to have people coming in and out of the house to show it, to put themselves at high risk of getting infected by the disease. Even though the banks have dropped interest rate right now, so it would be a good time for you to buy a home. If you're buying it, you get it at a really low interest rate, and you probably could get a lot of good bargain buying a house to get the price down, because there's not a lot of people going after a house right now. But there's also the risk, and there's reward in the risk, that if you know you're gonna be able to make the payments, this is the best time to go out and probably try to buy a home if you see one you did already like. But if you're gonna depend on your job, and your job might end up closed down and you won't be able to pay the mortgage on it, this would not be the good time for you. So there's some pros and cons here. The interest rate will be now the lowest it ever been that you can buy a house, but you can buy the house and you won't be able to pay the mortgage if you get laid off from your job, if your job shut down. If you know you work in the medical field, especially at a hospital, you should go ahead and do so, because you will have more work now to do than you ever had. So you don't have to worry about that. But if you work in another field, you probably need to reconsider, unless you have a lot of money already in the bank that you can take out and put down probably most of what the house value, or even buy it outright. This is the time to go for it. So guys, hope we get past this real soon. Alright guys, stay safe, be good, wash your hands, and try to keep your social distance. Try to avoid being out in public places as much as possible. And all the gyms in America is closed, so I can't go to no gym no more. I gotta work out in my house. I got some weights here, so I'm trying to keep myself in shape the best I can until the gym is back up again. And I'll see how well I can do so to maintain. Alright guys, thanks for watching. Peace out. Remember to share, like, subscribe to my channel. If you do have a channel and you subscribe, I will come back and show you the same love. Alright guys, have patience. I might not get to you right away, but I will. Alright, stay real.